Good morning. Hello, welcome to all of you at our platform eduudaan.co.in. And I'm your mentor, Dr. Rinki Sisodia. Today we'll discuss MPPSC Dental Surgeon Exam 2025. Okay, so let's start the paper. I'll share the paper with you. This is set C of MPPSC Dental Surgeon Exam. First is the section A, which consists of 50 questions. We'll do that first. Okay. First question. As per Article 164 of the Constitution of India, the Chief Minister of a state is appointed by option D, Governor. Question number second. In which year was the MP Municipal Corporation Act enacted for the efficient administration of the urban areas in Madhya Pradesh? That is option B, 1956. Question number three. Who is the chief advisor to the chief minister? That is option C, chief secretary. Question number fourth. Which committee appointed by the Government of India recommended in its report in 1957 for the establishment of three-tier Panchayati Raj system? That is option D, Balwant Rai Mehta Committee. Question number fifth. Who is appointed by the Commissioner cum Director of Veterinary Service MP to implement the provision of Madhya Pradesh Gomansh Vad Pratishedh Adhiniyam 2004? It's the option D, Cow Progeny Commissioner. Question number six. The famous Chalcolithic site, Kayatha, located on the bank of which river? Option A, Bass. Question number seven. From which place in Madhya Pradesh has Ashoka's minor rock addict not been found? Option A, Panguradia. Question 8. Which of the following rulers defeated the Hun invader Mihir Kul, that is Kumar Gupta and Chandragupta Vikramaditya? Option D, 1 and 4. Question number 9. Which fact about the Kalchuli ruler Karna Dev is correct? That is option D. He defeated Parmar ruler Munja. Question number 10. Which Muslim ruler of Gujarat defeated and imprisoned Sultan Hussain Shah of Malwa? That is option B. Bahadur Shah. Madhya Pradesh Council of Employment and Training is an institution related to which department? That is Employment and Training Department. Sorry, yes, Employment and Training Department, option B. Question number 12. Which department is the nodal department in Madhya Pradesh for the implementation of Forest Right Act 2006? That is a Tribal Affairs Department, option D. Question number 13. Which of the following criteria is not required for declaring any area as scheduled area under the fifth schedule of the Indian Constitution? That is D. A viable administrative unit such as district, block, tehsil. Question number 14. The Scheduled Caste and Scheduled Tribe Prevention of Atrocities Act 1989 is currently administered by which Minister of Government of India? That is Minister of Social Justice and Empowerment, option C. Question number 15. In which article of the Constitution provision has been made for reservation of seats for scheduled tribes in the Legislative Assembly of the state? That is Article 332, option C. Question number 16. Which of the following is used to design standardized web pages so that the web content can be read and understood from any computer? That is HTML, option A. The full form of Common Standard for Coding Indian Script ISCII is option C, Indian Script Code for Information Interchange. Question number 18. Which of the following type of cloud deployment model possesses the characteristic of highest security? That is option A, private cloud. Question number 19. Data collected from sensors are passed over to which component of Internet of Things for computations to the cloud or processing nodes? That is option B, network. Question number 20. That is, while pre-processing the data, which process is used to change the data into format that are suited for the analytic process? That is option C, data transformation. Who wrote Transfer Property in British India book? That is option D, Hari Singh Gaur. Question number 22. Which of the following leaders of movement against the British land revenue system in Bundelkhand with their regions? That is option A, Maharaja Parichet from Narsinghpur, Madhukar Shah from Jodhpur, Hridesh Lodhi from Narhat, and Dilhan Shah from Hirapur. Question number 23. Who was not among the revolutionaries attack at Indore residency during the freedom struggle of 1857? That is, option is A. Sadat Khan. 24th. Which freedom fighter took control of the British cantonment at Bhopawat and Sardarpur during the 1857 freedom struggle? That is Bakhtawar Singh. C. Question number 25. In Pitora art, the person who paints the picture is called Lakhindra. Option B. 26. The Nobel Prize in Physiology or Medicine 2024 was awarded for which field? That is COVID 19 vaccine. B. The theme for World Oral Health Day 2025 is A Happy Mouth is a Happy Mind. Option D. What is Ayushman Sakhi WhatsApp Digital Help Desk? Question number 29. Recently, Madhya Pradesh government has approved in year 2025 which scheme to promote road safety and timely assistance during accident? That is Ayushman Accident Insurance Scheme. Okay. Question number 30. In which district of Madhya Pradesh PM Mitra, PM Mega Integrated Textile Region and Apparel Park has been established? That is Indore. Option A. 31 question. Which district of Madhya Pradesh is not covered by the jurisdiction of Bega Development Authority? That is Balaghat. Question number 32. Who is provided the benefit of Shankar Shah and Rani Durgavati Puraskar Yojana? That is to the student. Option C. 33. In which district was revolutionary Bhima Nayak of Nimar region who led the revolt against the British bond? That is Barwani. Option B. Question number 34. Where is the National Institute for Research in Tribal Health located? Jabalpur. Option D. Question number 35. Who is the author of the book The Rajgond Maharaj of Satpura Hills? That is Variar Alvin. Option A. Question number 36. Hinota is the main area of which mineral? Copper. Option C. Welspun Solar Project is in the district of Neemuch. Option A. Question number 38. Which is not one of the main bauxite producing district in Madhya Pradesh? Jhabua. Option D. Arrange the district of Madhya Pradesh in descending order according to population density in 2011. That is a Satna, Sagar, Damoh, and Raisen. Option B. Literacy rate in Madhya Pradesh as per 2011 data is less than Maharashtra and West Bengal. Option C. On which mountain range is Madhya Pradesh highest peak Dhupgarh situated? That is a Satpura range. Option A. Alluvial soil is mainly found in Madhya Pradesh in Morena, Bhind, Gwalior, Shivpuri. Option C. The lowest layer of the atmosphere surrounding the Earth is called troposphere. Option A. The main trees of monsoon forest do not include which of the following? That is D. Pine tree. Bila Dam project is in the district of River. Option C. In which city of Madhya Pradesh Rare Earth theme park is established? That is Bhopal. Option C. 47 question. In which district of Madhya Pradesh mainly manganese ore are found? Balaghat. Option B. 48 question. An underground water management system built in the Burhanpur is known as Pani Bhandara. Option B. In which city of Madhya Pradesh Water and Land Management Institution is situated? That is Bhopal. Option D. Which status did Madhya Pradesh achieve in the Business Reform Action Plan 2022? That is top achiever. Option B. Okay, now we go towards section B, that is a dental surgeon. Okay. Now, 51 question about which of the following is the correct description of extended preparation in conservative dentistry? That is option B, preparation extending beyond the confines of the carious lesion to prevent recurrence. 52. Which of the following is considered the most reliable method to achieve effective disinfection in root canal? That is a laser activation combined with sodium hypochlorite. Option B. Question number 53. Which of the following is the most common cause of post-endodontic pain over instrumentation of the root canal? Option A. 54. Which factor is least critical in determining the prognosis of endodontic treatment? That is the health status of the patient. Option D. The first step in managing a fractured anterior teeth is option A, that is radiographic examination. Question number 56. Because of its constancy in position, which of the following tooth is called as a key to occlusion? That's the maxillary first permanent molar. Option B. Spacing between deciduous dentation in a 4-year child indicates option A, good growth. All the appliances are used in maxillary construction except That is option D, Jasper Jumper. Question number 59. Rapid expansion should not be done in a young child with primary dentition because there is a risk of distortion of facial structure with rapid expansion. Option B. 61. The preferred surgical procedure for most patients who need mandible advancement is sagittal split osteotomy. Option B. 61. The average resting plaque pH in a healthy child mouth is approximately between 6 and 7. The most common recommended technique for toothbrushing in small children is scrub technique. That is option A. Question number 63. A young child with endodontic bracket is recommended a and tufted brush for effective plaque removal around brackets and gingival margin. Option B. Now, question number 64. A 5-year-old boy becomes calm after watching an older sibling undergoing a painless tooth filling. This is an example of modeling. Option B. A 4-year child in dental clinic insists on sitting on the parent's lap during treatment and believes that dental chair might eat him. This reflects which Piaget stage, that is a pre-operational. Option B. Ludwig angina is characterized by raised tongue. Option A. Biopsy specimen removed for examination are immediately placed in 10% formalin. That is option B. Protein content of less than 4 mg per 100 ml is seen in keratocyst. Option C. The gas used in local anesthetic cartridges is nitrogen. Option C. The Abbe slender flap is used in the reconstruction of the lip. Option A. Which of the following conditions caused by vitamin D deficiency in children? That is rickets. Option D. 72 question. A dentist suffered from hepatitis B infection 3 months back. His laboratory tests are normal, but he is not allowed by the medical board to do surgical practice. Which among the following represent his current status? That is a healthy career. Option B. Question number 73. Compared with autoclave, the use of dry heat oven for sterilization has which of the following disadvantage? That is a time consuming. Okay, the bacillus of tuberculosis and cholera vibrio was discovered by Robert Koch. Option A. The vitamin deficient in alcoholics which leads to rapid conversion of pyruvate to lactate resulting in lactic acidosis is pyridoxine. Option A. Question number 76. Theory of shock absorption of periodontal ligament is viscoelastic system theory, that is option C. Cellular remnant of Hartwig sheath embedded in calcified ground substance is seen in option B. Cellular intrinsic fiber cementa. Universal curates are Gracie curate, cathepsin gene mutations located on chromosome 11q14 causes Chedak-Higashi syndrome. Option B. Okay, to hold apically displaced partial thickness flap on periosteum, suture used is horizontal mattress suture. Option A. Surgery is carried out in which stage of general anesthesia? That is a stage 3. Stage 1 is analgesia stage, and stage 2 is basically the stage of excitement, delirium, and involuntary movement, and stage 4 is stage of medullary paralysis, and stage 3 is a stage where surgery is carried out. Okay, when blocking a nerve containing both motor and sensory fiber, the last functional property lost is proprioception. C. The color of a nitrous oxide cylinder is blue. Option B. Green stick fractures are most common with children. Option C. Sedax is glutathione. Option A. Which of the following medications has been shown to be an effective replacement for cyclosporine without causing gingival enlargement? That is amlodipine, calcium channel blocker. Option A. Which of the following is a contraindication for performing xylography? That is option B. Allergy to contrast media. Question number 88. What's the recommended minimum distance an operator should maintain from the patient when adhering to the position and distance rule during an X-ray exposure? That is option B, 6 feet. 89th question. Following structures most likely to form a ghost image on a panoramic radiograph. Ghost image means distorted, okay, enlarged, and sometimes invisible. Okay, so here it's a distorted, okay, and magnified. So it's option C, earring located between the X-ray source and the center of rotation. Okay, what's the primary cause of partial volume artifact in CT imaging? That is option B, polyenergetic X-ray beams causing differential attenuation. Okay, a dentist examines maxillary sentence of a 12-year-old child and finds small opaque paper white areas with less than 25% of tooth surface involved. What's the score as per Dean fluorescence index? That is normal. Okay. The dentist manipulates certain information given to the patient in the course of treatment, which ethical principle is breached here. That is the autonomy. A dentist wants to find best treatment for a patient with early enamel caries. He searches literature and finds few publications which are the following is highest level of evidence in evidence-based practice. That is a systemic review and meta-analysis. Question number 94. A dentist plans a study to compare the effectiveness of two mouth rinses and plaque on plaque score. She randomly assigns 30 patients into two groups, each receiving a different mouth rinse and measures plaque scores after 2 weeks. Which type of study design is this? Randomized controlled trial. Okay. Question number 95. A dentist conducts a survey in a rural school to find the prevalence of dental caries among 6 to 12 years old children. He finds that out of 200 children examined, 80 have at least one carious tooth. What's the prevalence of dental caries in this population? That is a 40%. Question number 96. Which of the following is closely associated with the aging and geriatric endodontic? That is the calcified canals, option C. Which of the following material has a best record in terms of long-term success as a root canal sealer? That is option A, zinc oxide sealer. Which of the following best describe the role of bacterial biofilm in endodontic infection? That is C. Bacteria within the biofilm exhibit increased resistance to both host defense and treatment protocols. Okay, question number 99. In endodontic practice, what's the purpose of the crown down technique? That is to maintain the integrity of the root canal system during cleaning. Question number 100. Which instrument is work well for severing pulp at the constriction level? That's a barb broach. Question number 101. Identify the development uh, and behavior disorder consisting of abnormal development of social skills, limitation in the use of interactive language, uh, and sensorimotor deficit. So it's an autistic disorder. Option B. Match the following. Okay, correct option is A. That is Down syndrome is related to macroglossia, delayed eruption, periodontal problem. Hearing impairment, avoid sudden loud noise, use sign language or lip reading. And autism spectrum disorder, that is a short visit, gradual desensitization, and reduced sensory triggers. Okay. Now, question number 103. Which among the following is an absolute contraindication for extraction, that is a hemangioma? Option C. 104. Which of the following is true? That is about management of children with cleft lip and palate, that is option C. Require multidisciplinary dental management. Question 105. A pre-surgical orthopedic appliance used in infant with cleft lip and palate to align the maxillary segment and reduce cleft gap before surgical repair, that is a nasoalveolar molding device. An age estimation method that assesses the mandibular left-sided teeth and is the most widely used technique for assessing age in children and adolescents is divergence method. Option B. According to Suchihase classification dividing the pattern of grooves in lip print, branch grooves are classified as type 2. Option B. Scarlet fever is caused by alpha hemolytic streptococci. Option A. Strawberry tongue is associated with scarlet fever, with which disease raspberry tongue associated tularemia. Option B. Biopsy from a lesion shows numerous irregular C-shaped trabecula of woven bone not connected to each other. Early lesion shows more of fibrous tissue, whereas advanced lesion shows more of bony trabecula, imparting the characteristic Chinese letter pattern. Identify the condition, that is fibrous dysplasia. Option B. Which of the following radiographic feature is an early and reliable sign of hyperparathyroidism? That is option A, increased thickness of lamina dura. In the tube shift technique, that is slope rule, if an object moves in the same direction as the X-ray tube shift, what's the object located? Where is the object located? That is option C, lingual to the reference structure. 113 question. Which of the following radiograph features most characteristic of advanced rheumatoid arthritis involving the TMJ? That is the erosion of the anterior and posterior condylar surface. Option B. Okay, jug handle view is a modification of which radiograph? Towns projection. Option D. Which topical therapy is most established for managing burning mouth syndrome, typically administered by Swiss and spitting out benzodiazepine? That is option D. Which of the following is an RNA virus? That is a parvovirus. Option D. Kaposi sarcoma is a neoplasm of vascular endothelial origin. Option C. Mucopolysaccharidosis are a heterogeneous group of metabolic disorders that are inherited as autosomal dominant. Option A. A lesion characterized by focal area of color change that's not elevated or depressed in relation to its surrounding is called as macule. Option B. Which one of the following staining method is considered a gold standard for identifying the presence of amyloid? That is phosphotungstic acid hematoxylin, PTH. Okay, necrosis of periodontal ligament and bone caused by pressure severe enough to force the root against the bone leads to bone resorption from viable periodontal ligament and form and from narrow spaces called as undermining resorption. Option B. Heart tissue lasers, neodymium Voyage laser. Option B. Okay, sixth complication of diabetes mellitus is periodontal disease. Option C. The outermost cells of stratum spinosum contains numerous dense granules which are modified lysosomes called as desmosomes. Option B. Okay, definitive subgingival curettage procedure performed with a knife is gingivectomy. Option A. Question number 126. A 9-year-old child present with deep occlusal grooves on first permanent molar with no clinical signs of dental caries. What's the best preventive approach? That is a pit and Fisher sealant application. Option B. A 35-year-old male patient visits a dental clinic with a history of tobacco chewing for the past 10 years. He expressed a desire to quit but is unsure how to begin. What should be the first step as a dental professional according to the 5 A's model? That is, ask about tobacco use. Okay, question number 2128. A patient with missing teeth due to chronic periodontitis receives complete denture. What level of prevention does this intervention represent? That is option C, tertiary. Question number 129. In a school dental health program, a dental auxiliary places temporary restoration and educates children about brushing. This auxiliary is most likely a expanded function dental auxiliary (EFDA). Okay, question that is option B. Okay, question number 130. The recommended fluoride supplement for a 4-year-old child living in an area with fluoride content of 0.25 ppm in drinking water is 0.25 mg. Option A. The functional cusp bevel is given at an angle of which with respect to the longest of the tooth, that is 45 degree. Option C. Question number 132. Skyforcation is seen in maxillary molars. The ideal crown height space needed for fixed implant procedures should range from 8 to 12 mm. Option C. Masticated load of complete denture is option D, 20 kg. How much luting agent is required for the cementation of crown? 3/4 filled slightly up to the margins. Option A. Okay, in the pre-adolescent children, which of the following method can be used for rapid maxillary expansion? That is a split removal plate with a jack screw. Maximum leeway space is provided by second deciduous molar. Removable appliances are most effective in tipping movement. Which myofunctional appliance is more compatible with full-time wear? That is twin block. Option C. Question 140. Anterior bite plane is used for anterior deep bite. Option C. Okay. And dangerous area of face is named because of connection of cavernous sinus with facial through which vein? That is a maxillary vein. Option A. Which cartilage is associated with development of mandible? That is Meckel's cartilage. Option D. 143 question. During an inferior alveolar nerve block, the needle of the local anesthesia syringe is accidentally penetrated into the parotid gland. Which of the following structures is most likely to be penetrated? External carotid artery. Option D. Okay, pellagra is frequently associated with deficiency of which of the following? That is a niacin. Option C. Wilson disease is a disorder of which of the following? Copper metabolism. The most common cause of porosity in heat cure acrylic denture is polymerization shrinkage. Option A. Okay, which treatment is generally considered first line for myofascial pain in TM dysfunction? That is occlusal sprint therapy. Option B. Question 148. The distal most part of the denture on the lingual surface is influenced by which muscle? Superior constrictor. Option D. Burnout done on buccal and lingual surface to locate plastic or wax pattern for clasp arm is known as parallel burn blockout. Okay, Boucher's method of relining is a open mouth technique. Fine. So these were the questions related with the MPPSC Dental Surgeon Exam 2025, and we have done our best to provide you the correct answer key for the question, and the original key will be provided by the MPPSC, and at that time we will compare, and if we found any doubt we can refer again. Okay. Bye bye, and have a very nice day to all of you. Thank you so much.